Finding a plan has never been easier, thanks to the Medicare Plan Finder. Find and compare plans in your area, see your options, and join a plan that best meets your needs. Plan Finder shows estimated costs based on the drugs you take and pharmacies you choose to help you compare plans. And using your online account makes it faster to add or change your drug list and join a plan. Let's get started. First, visit medicare.gov/plan-compare. Click Login or Create Account for an easier, more personalized experience. Or click Continue without logging in to find plans as a guest. Not sure about your Medicare health and drug coverage options? Click Learn More about options. We'll log in. If you log in or create an account, you can quickly add drugs and save your drug list in favorite pharmacies, and easily make updates when you visit Plan Finder later. Enter your username and password. If you have Medicare but don't yet have an account, click Create an Account now. After logging into your online Medicare account, you'll see your name and your current plan. During open enrollment, October 15th through December 7th, you'll see the plan you'll have for next year if you don't make a change. You'll also see if you get any extra help paying drug costs. Start by choosing the type of plan you're interested in. You can choose a Medicare Advantage plan, a standalone drug plan, or a standalone drug plan plus a Medicare supplement insurance policy called Medigap. If you're not sure where to start, you can learn about your Medicare options before you see plans. Let's choose Medicare Advantage here. Then enter your zip code and click Continue. Be sure to scroll down to select your county, and then scroll down again and click Next. If you're not logged in, we'll also ask if you get help with your costs from programs like Medicaid or Extra Help. Once you answer the question, click Next. We'll then ask if you want to see drug costs when comparing plans. This can help you get a better idea of what your costs would be in each plan. If you check Yes, we'll ask how you normally fill your prescriptions. Then, click Next. Next, you'll add your prescription drugs. If you're logged in and you saved a drug list in Plan Finder before, you'll see your saved drug list. If you don't see all the drugs you take regularly, click Add Recently Filled Drugs to see all the prescriptions you filled in the last 12 months. Check the boxes for each drug you currently take. If you take all the drugs shown, just check the top box to select all the drugs. Then, click Next. If you check a box by accident, it's fine. Just click it again to uncheck it. We'll add one of the drugs on the list, Nexium. You'll return to your saved drug list. Confirm that the drugs listed are the ones you currently take. Don't list drugs you take temporarily, like an antibiotic. This will help you better estimate your regular drug costs and help you find the lowest cost plan. Don't see a drug you take on a regular basis on your list? Click Find and Add Drug to add it manually. If you're not logged in, you'll add each of the drugs you take one at a time. Enter the drug name and click Add Drug. We'll add Lantus, a type of insulin. If available, you'll be asked if you want to switch to a generic drug or keep the brand name drug you entered. Generally, generic drugs lower your costs, but make sure you add the name of the drug your doctor prescribed. You'll then add the dosage, the quantity you take, and how often you refill the prescription, like 30 pills every month, which is 1 pill per day. For some drugs, you'll add how it comes packaged. Check your prescription package for this information, or contact your doctor or pharmacy. The information is added for Lantus, so we'll click Add to My Drug List. After you add a drug, you'll return to your drug list and see that it's been added. If the list has drugs you no longer take, or your dosage has changed, or there's a drug listed that you don't recognize, you can remove the drug or edit it. We'll edit Nexium and change the dosage to 20 milligrams and quantity to 15 pills each month, which is about 1 pill every other day. Then, click Add to my drug list. This will update the drug on my saved list. Once the list shows all the drugs you take with the correct dosage and frequency, click Done Adding Drugs. Next, you can choose up to 5 pharmacies where you would fill your prescriptions. Drug costs can vary in each plan based on the pharmacy you use. Picking different pharmacies lets you see how plans work with those pharmacies and which would have the lowest costs. Generally, your costs will be lower when you use an in-network pharmacy instead of an out-of-network pharmacy. You'll be able to see the costs of your drugs at each pharmacy in plan details later in your search. We'll talk more about that later. Pick pharmacies you use now, or choose other pharmacies in your area to see if one may offer lower costs. To find pharmacies in your area, you can enter a specific pharmacy name, search by zip code, or search by your address to find the closest pharmacy if there are a lot in your area. Then, click Find Pharmacy. We'll enter the street Caddo Lane in Norman, Oklahoma, 73072. You can use the distance filter to show more or less pharmacies and see the ones that are closest to you. You can also use the map on the right to see their locations. Mail order pharmacy is listed first. Every plan with drug coverage offers mail order. It's usually a lower cost option, but not always, so it's a good idea to look at some other pharmacies too. If you select mail order, you can pick up to 4 other pharmacies. Choose the pharmacies you want by checking the Add Pharmacy box. As you choose pharmacies, they also appear in the blue bar at the bottom of the screen. To remove a pharmacy you don't want, click the X for the pharmacy in the blue bar or uncheck the box next to the pharmacy name on the list. When you're done picking pharmacies, click Done on the far right side of the blue bar. We'll pick mail order and 4 pharmacies. You'll now get the results from your plan search. During Medicare open enrollment, the first plan listed is usually your current plan's benefits for next year. It's the plan you'll have for next year unless you join a different plan. It's a good idea to look at your plan's benefits for next year to see what's changed and if your current plan will still meet your needs. When you're done, you can minimize that window by clicking Your Next Plan. If you want to see it again, just click Your Next Plan again. To see plans that only include benefits you want, click Filter Plans. For example, if you only want to see plans that include both vision and dental, select those choices from the Benefits filter. If you only want to see plans with drug coverage, select that in the Drug Coverage filter. The other filters allow you to see only certain types of plans, plans with a certain Medicare star rating, or plans offered by a certain insurance company. And if you take insulin, you can even filter plans that may offer lower costs for insulin by checking Insulin Savings. Pick all the features you want your plan to include and click Apply Filters. We'll pick Vision and Dental, includes drug coverage, and Insulin Savings. Outside the filters area, there's also a way to add plans for people with certain needs. There are plans that are just for people with both Medicare and Medicaid, people with a chronic or disabling condition like diabetes or heart disease, and people who need long-term care in a facility or at home. Plans are sorted automatically by the lowest drug plus premium cost, but you can sort in other ways too. Let's take a look at one plan's information. As you view a plan, you'll see many important things to consider. You'll see its overall star rating between 1 and 5 stars. You'll also see some of the different costs and benefits it offers, and whether it includes drug coverage. Looking a little closer at the costs, you'll see the plan's monthly premium. Since we're looking at Medicare health plans, the information reminds you that you need to keep your Part B coverage to join and stay in the plan once your plan coverage starts. Remember, you'll have to pay your Part B monthly premium in addition to the plan's premium. You'll see your estimated yearly drug plus premium cost since this plan includes drug coverage. This amount is an estimate of the cost to fill the drugs you entered at the pharmacies you chose, plus your monthly premiums. But it doesn't include any estimated health costs, like copays or deductibles. If you're looking for a plan for next year during Medicare's open enrollment, this cost will provide an estimate of the amount you may pay for your premiums and drugs for the entire year. But if you're looking at plans in the middle of the year, this will include costs for the rest of the months left in the year. For example, if you're looking at plans in May, it will include the costs for June through December. Remember, this estimate doesn't include other costs for health services. You'll also see other costs, like deductibles and the maximum amounts and copays you pay for health services. To learn more about what each of these items are, click on the underlined text to open a window with more information. To get more details about a plan, its costs, and what's covered, click on Plan Details. It shows an overview of cost information. Use the gray bar on the left of the screen to quickly find the details you want. To see more details about extra benefits the plan covers, like vision, hearing, or dental, you can select Extra Benefits. You can also look under Pharmacies in the Drug Coverage and Costs section to see how the plan works with each of the pharmacies you chose. Let's look at pharmacies. It will tell you if the pharmacy is in-network or out-of-network. Generally, costs are lower if you use an in-network pharmacy. If none of the pharmacies you chose are in-network, click Change Pharmacies to go back to add different pharmacies to see if they're in-network. As you scroll down, you'll also see detailed information about the costs for each drug you take at each pharmacy you choose. If a drug you take isn't covered by the plan, it will display the full retail cost across all the columns. If a drug you take isn't covered by the plan, you can look at other plans or consider asking your doctor whether you can take a generic drug instead of the brand name drug to help lower your costs. Generally, you'll want to look at your estimated monthly drug costs to see your costs broken down for each month of the year. When you're done looking at plan details, scroll to the top of the page and click Back to Search Results. You'll come back to your search results, and at the top you'll see your current plan again. You can minimize it again by clicking Your Next Plan. You can select up to 3 plans to compare at one time. To select plans to compare, check the Add to Compare box. You'll then see it in the blue bar at the bottom of your screen. If you're currently in a plan, it will automatically be included in the blue bar. You can keep it for the compare, or you can remove it if you want to compare a different plan. Once you've added all the plans you want to compare, click Compare on the right end of the blue bar. We'll pick 3 plans to compare. Now you see all of the plans you chose side by side. First, you'll see basic cost information like premium and deductibles. Then, scroll down to see more information about each plan, like benefits and costs, whether the plan covers extra benefits, and a quick view of your estimated drug plus premium cost for each pharmacy you chose. When you find a plan you're interested in, scroll to the top or bottom of the page and click Plan Details for more information. Or return to your search results by clicking Back to Results in the left light blue box at the top of the Compare screen. When you find the plan you want to join, click Enroll. A pop-up window will start your application to join the plan. After you complete your application, you'll get a confirmation number. You can also contact the plan directly to join. To get the plan's contact information, click Plan Details. The plan's contact information is at the end of the Plan Details page. Once you submit your application to join a plan, you'll hear from the plan within 10 days, or log into your account to see the status of your application. When you're done using your account, be sure to log out and close the browser window to help keep your information secure. Need more help picking a plan? Call 1-800-MEDICARE, 1-800-633-4227. TTY users can call 1-877-486-2048. For more information, visit Medicare.gov. Paid for by the Department of Health and Human Services.